So what's the problem? Why is there still such a fuss? Well, part of the problem is the fact that a Democratic president named Barack Obama passed the law.
That was the problem with Obamacare, apparently, and that was President Obama, who likes Obamacare. No surprises there. He says it is working, just needs a little fixing, like maybe a single-payer system. Let's bring in Congressman Tom Price, Republican from Georgia. Congressman,
hey,
I know you're shaking your head about the single-payer thing. I got that. But has Obamacare created problems for your constituents in your area?
Oh, without a doubt. I was shaking my head because the president's delusional if he thinks that the concerns we have about Obamacare is that it was passed by a Democrat president and his name was Barack Obama. The problems we have is that our constituents, the men and women and kids across this country, are receiving less quality health care right now than before. As you mentioned yourself, the number of insurers has gone down across the country. Florida from 18 to 5. Here in Georgia, we're seeing insurers vacate the state because the exchanges just don't work. We've had billions of dollars lost in the co-ops. 17 of the 23 co-ops have gone belly up from a financial standpoint. So the quality is decreasing. The affordability is not what it should be. The access to care is not what it should be. So this, from soup to nuts, is a bad idea, not just for the economy of the country, but for the quality of health care in the country, which is why we believe it's time to start over.
But the president wants, and I believe Hillary Clinton wants, the public option, which, of course, is a form of socialized health care. It's more government care. What would happen in your district if you got that kind of thing moving in?
Well, we'd go from bad to worse. The problem isn't that there isn't enough government involvement in health care. The problem is that there's too much. What we need is a system that we call patient-centered, where patients and families and doctors are making medical decisions, not your federal government, not Washington, D.C. There's a better way to do it. It's at better.gop, better.gop. We've put forward a very comprehensive solution for health care that would put patients and families and doctors in charge of these decisions, solve the insurance challenges, save hundreds of billions of dollars, provide more choices for patients, which is what we need. The last thing we need is the government making more decisions. And we've just heard recently that because people are not re-upping in the exchanges, the government's going to assign you an insurance company to cover your health care. This doesn't make any sense at all.
Well, if Donald Trump is not the president, if it's Hillary Clinton, can you still get your plan through if it's Republicans run the Senate and the House?
Oh, I think so, because I think there are men and women of goodwill on both sides of the aisle that want to solve this challenge. One of the problems that we've had is that Democrats have been unwilling in the House of Representatives to do anything because they didn't want to offend the president. Once he goes away, then we've got a great opportunity to move this in a better direction. And we will. There are positive solutions that we can put in place, and that's the goal that we have, is working toward those positive solutions with other individuals who believe that it absolutely must occur.
By the way, Zeke Emanuel, one of the architects of the law, was on Maria Bartiromo's show earlier today on Fox Business. He said to fix this little problem with Obamacare, you've got to have an expansion of Medicaid, you've got to have subsidies, bigger subsidies to the insurance companies, and you've got to have more subsidies going to consumers. I think that's going to cost an arm and a leg. Can you stop it?
Absolutely. The current plan doesn't work financially, either for states or for the federal government. What Zeke talks about is absolutely not just unaffordable, but it's unworkable from a structural standpoint within healthcare. What we need are greater flexibilities for patients and for those providing the care to patients all across this land. We need greater options, greater choices, a higher level of accessibility and affordability for the American people, both of which have gone away. You realize that the premiums across this country are going up by double digits this year, and the deductibles that have skyrocketed, not just in the exchange plans, but in private plans and in employer-sponsored plans. That's because of Obamacare. Health care is less affordable now than it was when Obama put his plan in place.
Got it. So, Congressman Tom Price, thanks very much for joining us, sir. Appreciate it. Thank you.
Thanks so much, Stuart.